Well, here's an article that ran this week in the New York Post about the importance of hand washing to help prevent the coronavirus. Headquartered in Atlanta, Georgia, the Centers for Disease Control and Prevention this week is emphasizing a simple step we can all take in the face of the coronavirus. Now, hand washing is a good idea in general, especially during the flu season, but it's also very important now with all the news that keeps coming out about the spread of the coronavirus. Can a simple thing like washing your hands really slow down an epidemic? Yes. Now, if you're skeptical, as I know some of you are, then Google medical news today and read the research that shows the connection between personal hygiene and disease transmission. I'm not going to try to persuade you here. But lots of people who do wash their hands aren't even doing it right because they don't use soap, they get done too fast, they're not scrubbing good enough, if at all, and they're totally bypassing under the fingernails. It's been a long time since any of us have been in preschool, so if you need a refresher, YouTube it. But this channel uses today's headlines as a springboard to talk about the past. And what I want to focus on, very briefly, is some of the history of hand washing. It's time for another episode of the history behind the headlines. In the 1800s, going to the hospital could literally kill you, all because doctors didn't always wash their hands. At that time, a doctor could be touching and handling a dead body as part of performing a 19th century post-mortem exam, and then these same busy doctors would just move on to the next task, like delivering a baby. But the doctor wouldn't stop to wash his hands before going to the delivery room. The advances we've made through medicine have come through trial and error, but sometimes the lessons the medical community has learned have come at a great price: human life. Oliver Wendell Holmes, a doctor in Boston in 1843, once said that infections which killed so many women could be prevented by simple cleanliness and hand washing. Historians tell us that in the 1800s, there was absolutely no science to medical practice, and many patients who might have survived their diseases died as a result of the treatment they were given. This was a time when common injuries included being kicked by a horse or getting stabbed in a bar fight. But why the pathetic hospital treatment? What exactly was going on? Perhaps you've heard the joke, calling Dr. Bob, calling Dr. Bill, calling Dr. Kill Patient. Well, that wasn't too far off in the mid-1800s America. You see, doctors were routinely performing autopsies, in part as a way to get to the bottom of a disease. But performing autopsies contributed to a growing trend in the dirty appearance of many doctors. And because these doctors were highly respected in society, the idea emerged that the dirtier the doctor, the better the doctor. Think about that. The dirtier the doctor, the better the doctor. Today we see doctors in their white coats, but back in this time, physicians wore black for their patient interactions, since medical encounters were thought of as serious and formal matters. Now here's a picture of doctors in dark garb painted in 1875, entitled The Gross Clinic. It's a scene from Jefferson Medical College's amphitheater in Philadelphia, showing Dr. Samuel Gross and his assistants, all dressed in black formal attire, performing a leg operation on a young man. Microbiologist Raquel Kahler of Hardy Diagnostics once noted that in the 1870s, it was a point of pride for doctors to walk around in their coats stained with blood from the last autopsy or surgery they performed, after which they headed straight to the maternity ward to do their shift delivering babies. And in his book on the history of Chicago's Cook County Hospital, John Raffensperger noted that around this time, the Chicago hospital's medical interns would perform autopsies in the morgue and then would deliver a baby without washing their hands. Convincing doctors to wash their hands wasn't easy. Dr. Raffensperger's research into Cook County Hospital in the 1800s revealed that many Chicago doctors refused to believe that they were responsible for these terrible infections and refused to wash their hands before delivering a baby. Now, like a Monday morning quarterback, it's easy to beat up on these doctors for not knowing any better and not believing their colleagues who proposed a better way. But they did eventually come round, as we shall see. And so today, as in the case of COVID-19 coronavirus, we see doctors using the best science to stop the spread of the virus. In fact, it was a Chinese doctor who tried to issue the first warning of coronavirus. Dr. Li Wenliang warned his colleagues, but the Chinese government tried to shut him down for fear of the negative publicity. And regrettably, this Chinese doctor later died from the very virus he tried to warn others about. So governments can make things worse. Still, we have far more advanced science available to today's doctors than yesteryear. But it was in the 19th century that we see an approach to public policy based on solid principles: observation, identification, isolation, and contact tracing. This kind of procedural thinking helped lead to the discovery of the importance of hand washing. It was Hungarian Dr. Ignaz Philipp Semmelweis who helped the medical establishment understand the connection between cleanliness and puerperal fever. This was in 1847. Puerperal fever is a fever following childbirth, so moms and their babies were affected. But his colleagues didn't believe the good doctor, not right away anyway. In fact, they either made fun of him or just ignored him. And when he died, well, let's just say he wasn't a happy man basking in the glow of his hand-washing discovery. He died a depressed and bitter man. Like Dr. Li Wenliang in our day, Dr. Philipp Semmelweis tried to warn his colleagues about a real threat. Now, Dr. Philipp Semmelweis demonstrated in 1847 that puerperal fever could eventually be prevented by simply having doctors and hospital staff clean their hands and tools when in contact with moms and babies. Still, it took several decades for doctors to wash their hands. It took some convincing to get doctors to wash their hands before treating patients. Now they try to convince patients to always do the same to avoid getting certain viruses. But doctors also remind us of the need to keep a healthy perspective in the face of global epidemics. For example, the Chicago doctor who treated the first people with coronavirus in the Windy City was quoted in the local media as saying, "A few years ago it was SARS, a few years ago it was Ebola, in 1918 it was the Spanish flu. We always have a new enemy coming up, rearing its head, and we have to prepare globally. The first three things are don't panic, don't panic, don't panic." There it is, y'all. Doctor's orders, don't panic. But he also said to prepare. Yes, the best weapon against the coronavirus, which can spread through coughing and sneezing, is to wash your hands thoroughly with soap and water. And that fact came about through some hard lessons dating back to 1847, long before the coronavirus even appeared on the scene. Before 1847, we could not always clearly see the connection between hand washing and disease transmission. Well, guys, that's all I have for now. So thank you for watching. And if you'd like to know more, be sure to read the notes that I left in the description with some links for additional information. Also, feel free to comment. I do want to know what you think, any thoughts that you might have. I'm looking forward to learning from you as well. And if you have some questions, go ahead and leave it there. And also, I'll have a new video soon. In the meantime, if you want to make your life more pleasurable, feel free to hit the subscribe button. And remember, the past is never dead. It isn't even past.